Good morning, everyone. So today we are going to discuss another topic, planning and evaluation. So we all know what is term, what you mean by the term planning. Okay, so let me share the uh, presentation for you. Okay, so today we'll be dealing with yet another topic, planning and evaluation. Okay, according to E.C. Banfield, a plan is defined as a decision about a course of action. So a plan tells you how you are going to do that action. Planning is both art and science, and it includes defining the problem, setting priorities, developing specific goals and objectives, determining alternative strategies, and method of implementation. So what is this National Health Planning? The orderly process of defining community health problems, identifying unmet needs, and surveying the resources to meet them, establishing priority goals that are realistic and feasible, and projecting administrative action to accomplish the purpose of proposed program. So, what is a need? Why we want to know about these terms, planning and evaluation? So, as a dentist, or as a doctor, or as a health professional, we are going to, we will have to plan, or we will have to schedule some health programs, mainly oral health programs. So, in that time, this planning, or if we know the steps in planning, it will help us to achieve that target very easily. Then moving on to the purpose of planning, to match the limited resources with many problems. So while planning any oral health programs, we should be aware of what all resources we have. So we have to match those resources with the targets what we want to achieve. To eliminate wasteful expenditure or duplication of expenditure. For example, we have time or manpower or money is some resources what we are having while going for a oral health program. So if we can plan such activities prior before going to conduct those programs, we can eliminate some wasteful expenditures, and also to develop the best course of action to accomplish a defined objective. So, for example, in a population with a periodontal problem or oral cancer, the different populations will have different kind of problems. In urban areas, dental caries will be the most prominent dental diseases, and in the rural areas, sometimes it can be periodontal disease. So, if we can plan accordingly, we can develop a certain best course of action to accomplish or to overcome that dental problem. These are some of the terminologies which will come across my presentation. First one is health needs. Deficiency in health that call for preventive, curative, control, or eradication measures refers to health needs. Then resources. The manpower, money, material, skills, knowledge, techniques, and time needed for available for the performance or support of the action directed towards specified objectives. So the resources means what we have in our hand to accomplish that mission. It may be manpower, money, materials, skills, knowledge, techniques, and also the time. Objectives. An objective is a planned end product of the activities. The desired state to which all the aims are targeted are called objectives. Goal, the ultimate desired state towards which objectives and resources are directed. So it's a desired end product of those activities. Program, a sequence of activities designed to implement the policies and accomplish objectives. Then a plan, a blueprint for taking action. So the plan means how we are going to conduct those activities. So that blueprint is called the plan. So a planning is a systematic approach to defining the problem, setting priorities, developing specific goals and objectives, and determining alternative strategies and methods of implementation. Planning results in the formulation of plan. Then we'll see the stages of planning. So before the stages of planning, we can just have a look at the uses of planning, how the planning will help us to match the limited resources with many problems, to eliminate wasteful expenditure or duplication of expenditure, to develop the best course of action to accomplish a defined objective. Next comes the stages of planning. The first one is situation analysis. Next is problem identification and formulation of objectives, formulation and analysis of alternative strategies, identification of special efforts, strategy selection, program formulation. So I'm 100% sure that you will be a bit confused about all these various steps that come across the stages of planning. So we'll see in detail. The first one is nothing other than situational analysis. Data may be collected from the whole population or from a group. So we'll collect the data from that particular population on whom we are going to plan an health activity. So the situational analysis data may be collected from the whole population or from a group. A group means the samples. Sometimes it will be difficult for us to collect the data from the entire population. In such cases, we can make a sample population and can easily collect the data from that group. This involves collecting data on oral health status, evaluation of existing oral health services and personnel and resources available for implementing the proposed program, identifying the social, cultural, and economic factors that may facilitate or impede implementation of a program. So this information includes the information required includes number of individuals in the population, geographic distribution of the population, the rate of growth, population density and degree of urbanization, ethnic background details, diet and nutrition levels, standard of living, healthcare facilities available, public and private schools system, general health profile, patterns and distribution of dental diseases, history and current status of dental programs, fluoride content of water. So this situation analysis help us to define problem and to identify its extent and severity, obtain a profile of a community to ascertain the cause of the problem, determining priorities to evaluate the effectiveness of the program. So the situation analysis help us to know better about the which problem is more prevalent among that population. So if you are planning for a program which is targeted to against that particular problem which is most prevalent in the society, then only the community participation will be there for such programs. Next one, the second one is problem identification and formulation of objectives. These objectives should include meet the purpose of the study, should be phrased clearly and leaving no doubt regarding what has to be measured, should be realistic and formulated in operational types which can be applied in practice. So the objectives are of two types, short term and long term. So in short, we can make the difference between these two as short time is of up to 2 years and long term more than for 2 years. So about the specifications of objectives, what, extent, who, where, when. What means the nature of the situation or condition to be attained. Extent means the scope and magnitude of the situation or condition to be attained. Who means the particular group or portion of the environment in which attainment is desired. where the geographic areas of the program. When means the time at or by which the situation or conditional things to be happen. So regarding the oral health program problem, the following questions are to be answered. Which oral health problem should be prevented? Which oral health problem can be effectively prevented? Which are the target groups for the planned program? How quickly the objectives can be achieved? What resources, financial, physical, and manpower could be made available to the program? Next is planning of program activities. Under the following components, what is going to be done, who will be doing it, and when it will be done. So what, who, and when is very much important while planning, when we are planning for an oral health program activity. Constraints that commonly occurs in community dental programs. Constraints means the factors which stand against the activities target for health improvement. Attitudes of professional organization, lack of funding, restrictive government policies, inadequate transportation system, labor shortages, inadequate facilities, negative community attitude, population, socioeconomic, cultural, and educational characteristics, amount of time available. So while planning for an health activity or health program, we have two things in our hand. One is the resources, that is mainly manpower, money, time, skill, knowledge, etc. Secondly, we have few constraints or challenges which will come across the smooth functioning of these health activities. It can be the attitudes of various professional organizations, lack of funding. If you do not have a proper budget or money, we cannot efficiently conduct any program. Restrictive government policies. So in times of COVID-19, we have numerous limitations from local self-government or from government authorities in conducting certain oral health programs. Inadequate transportation system. So the general public usually have a tendency that the dental clinics are mainly set up in the urban areas. So the clinics were made mainly for the urban people, and those living in the rural, especially the tribal population, have a negative attitude in reaching to the oral health services. Labor shortages, that means a lack of manpower, inadequate facilities, negative community attitude. So if our programs are not directed towards the problems which are more prevalent in the society, the common people will have a negative community attitude towards that program. Population, socio-economic, cultural, and educational characteristics. While designing a program, we should be very well thorough with the cultural, various religious barriers or backgrounds of the society, and the time is also a can be a constraint in some circumstances. Next is formulation and analysis of alternative strategies. That means how we will overcome such constraints. Each alternative strategy should be examined carefully for its technical, social, political, and financial feasibility. Next, about the fourth one, identification of special efforts. That is collection of special data in times of need, field trials, pilot studies, recruitment, training program, changes in organization. So we can have certain trials, or we can do some sample studies called the pilot studies. If we are going for an oral health program for a population, first we will do it among 100 people. So that will be our pilot study, and we can make any change in the design according to the results obtained from these pilot studies or field trials. Next is the strategy selection. On the basis of feasible alternatives, advantages, disadvantages, we can decide about the various strategies or selecting the strategies which will help us to run the program in an efficient manner. structure. We have to also think about the steps for future implementation. Next is program formulation and implementation. Implementation means process of putting the program into operation. The what all things what we planned, we will go in this step. We will put it into operation. So implementation means running the program. The rules for implementation: specify clearly the activity, be sure someone is responsible for the whole activity, identify all preparatory steps prior to doing that activity. So while implementing the program, we should have these rules. List the steps in order, check the missing steps and add them, determine when each step should begin and end, check for correct amount of time, consult with the organization affected by the activity, identify potential problem, opportunities, etc. Specify what resources will be needed and what they have. Specify what constraints will need to be addressed. Make sure that all people involved are very much enthusiastic in running that program. Then about the types of planning, we have individual planning, group planning, and also the system of planning. So in addition to that, we have problem solving planning, program planning, and coordination of efforts and activities planning. So we'll see in detail. Then next comes the about the individual, group, and system. Individual means only one person is involved in such activities, and it is called as the individual planning. Group means it's not at all individual; it's a collective set of individuals are involved in such activities, and such a planning will be directed towards that group. Next is system. Not only humans are involved, it involves various other resources and constraints. These resources and constraints collectively and also the personnel involved in the program collectively makes the system. So that planning is needed for that smooth running of that system also. So after the planning, when the program is in the implementation stage or the planning is or the program is on the running stage, we also have to do the monitoring and evaluation. The evaluation means the collection and analysis of information to determine program performance. So that once the program is in the running stage, we have to monitor how the program is running. So the evaluation measures the degree to which objectives and targets are fulfilled and the quality of the results obtained. Evaluation is also defined as a collection and analysis of information to determine program performance. So evaluating means we are putting mark for the program, how program performance. It is mostly concerned with the final outcome and the factors associated with it. So the criteria, these are the criteria used in the evaluation of dental services put forward by WHO in 1972. Effectiveness means have the stated objectives been achieved, whether we were able to reach the targeted objectives gives you the effectiveness. Efficiency means what has been the cost in manpower or finance in relation to output of the program. So efficiency measures the cost of manpower or finance in relation to the outcome. Next is appropriateness. Is the program acceptable to both consumers and providers, and do the priorities reflect a proper interpretation of the needs of the population? Appropriateness means the acceptability of the program for both the consumers and also the providers. Next is the adequacy. Has the intended coverage of the target population be achieved, and are the services readily available? Gives you the measure adequacy. So the evaluation can be measured under the four headings: effectiveness, efficiency, appropriateness, and adequacy. Next, about the levels of evaluation. First one is the content, Next is the progress and the outcome. The content means validity and appropriateness. Progress means acceptance by providers and by the target population. The outcome means behavioral and other changes. Next, about the evaluation schedule. Preliminary evaluation, medium-term evaluation, final evaluation. So the types of evaluation, we can have different types, formative evaluation and summative evaluation. Formative means it refers to the internal evaluation of a program. It is an examination of the activities of a program as they are taking place. So the formative evaluation gives you the result when the programs are on the running stage. Summative evaluation means it judges the merit or worth of a program after it has been in operation. So it is an attempt to determine whether a fully operational program is meeting the goals for which it was developed. So about the formative and summative we discussed. Now the other types of evaluation: relevance evaluation, progress evaluation, effectiveness evaluation, impact evaluation, efficiency evaluation. So this is an important short essay for the most of the university exam types of evaluation. So the relevance means it refers to activities designed to determine whether the program is needed or whether the program is targeting its efforts at the individual is needed. So that is the relevance evaluation. Next is process or progress evaluation. It refers to effort made to assess the extent to which a program implementation complies with the program plan. Next is the effectiveness evaluation. It refers to whether program results meet a predetermined objectives, the extent to which the program meets the already set objectives. Next is the impact evaluation. It refers to the long-term outcomes of the program. So we already discussed before, long-term outcome means outcomes for more than 2 years. So the impact evaluation refers to the long-term outcomes of the program. It considers whether the intervention had any long-lasting effects on the ultimate problems that the program is intended to remedy. Next is the efficiency evaluation. It attempts to relate the results obtained from a specific program to the resources expanded to maintain the program. So also about the revision of the program after evaluation, if needed, necessary revision or modification should be undertaken. Replanning process same as planning process, but more precise data is needed for such a remodification. So thank you for your patient listening. So today we discussed about the topic planning and evaluation. So you will get you can have an essay on planning, steps in planning, types of planning, uses of planning, and regarding evaluation, the most frequent asked questions were types of evaluation and steps in evaluation process. Thank you.